we will talk about 5 signs and symptoms of irritable bowel syndrome. It is a common condition, it causes abdominal discomfort, and it affects around 15% of world population. It means it's quite common condition. Let's start. What is the first symptom? It's abdominal pain. Abdominal pain is the most common symptom of irritable bowel syndrome, and it occurs around 90% of patients with irritable bowel syndrome or IBS. In 90% of cases, we have abdominal pain. And what type this pain is? Usually, it's cramping sensation. Most common presentation of pain of irritable bowel syndrome is cramping. It can be aching, it can be sharp pain, but most common is cramping. Where is the location? Most common location is lower part of abdomen. It can migrate different parts. It's possible, but most common location is lower part. It's important. And this pain is associated with bowel movement. Somehow patients will associate this pain to bowel movement. They may say that I feel relieved this pain after passing stools. After bowel movement I feel better. Or they may say that he or she feels pain and she feels her bowels are moving and she feels cramps. So bowel movement is important association with abdominal pain. It's important sign. That's why we focus it. Usually it's relieved after passing stool. It's important also. And people have associations that people will say that I have this pain after stress. I have this pain after for example intake certain foods. So they have associations with triggers. It can be food, it can be stress, it can be different events. Usually it's foods or stress. Now let's say about second most common symptom. It's altered bowel habits. Patient will say that he has or she has diarrhea or constipation or alteration between these two. Sometimes diarrhea, sometimes constipation. It means mixed form. So we have 3 forms of irritable bowel syndrome. First is predominantly with diarrhea or IBS-D, IBS-C. IBS-C means irritable bowel syndrome, predominantly with constipation, and we have mixed form. It means IBS-M or mixed form when we have both constipation and diarrhea. Diarrhea and constipation, they are alternating each other. So we have this 3 form, and patient will say that she has diarrhea and she has sense of urgency also when she has diarrhea. And the third most common symptom is bloating and gas, and patient will say that she feels excessive fullness in her belly, excessive fullness in her abdomen is distended, frequent gas, rumblings, noises, and these symptoms, bloating and gas, worsens at the end of day when food are digested and gas are formed. Symptoms are worsened during end of the day, during night. Fourth most common symptom is urgency to toilet. Why this urgency happens? Because of diarrhea, and people with IBS predominantly with diarrhea say that they have sense of urgency. It's important symptom. It's not very common symptom, but it's important symptom, and it indicates IBS. It's characteristic for IBS when person has chronic diarrhea and person says that she has urgency to restroom, to bathroom. So it means IBS in many cases. And fifth most common cause is mucus in the stool. Stool consistency is changed, and sometimes mucus occurs in the stool, and it is fifth most common cause of IBS. Now let's say how we diagnose IBS. For diagnosis, it's very important part, and pay it attention. For diagnose IBS, we should exclude other disease. First and most important part is we should exclude other disease and exclude red flags. What are the red flags? Red flags are blood in the stool is red flag, high fever is red flag, infection red flag, unintended weight loss is red flag, and family history of colon cancer is red flag. So we should exclude these red flags, and after this, if we still have these symptoms, we diagnose irritable bowel syndrome. And for diagnosis, we need recurrent abdominal pain at least 1 day per week, at least 3 months, and we need two or more symptoms out of these three. These three symptoms are, these symptoms is related to defecation, it's important symptom, and or change in stool frequency, and or change in stool form or appearance. So stool appearance and form can be changed, stool frequency, so a person can have constipation or diarrhea, and it's related to defecation. So person will say that his pain is relieved after defecation. That's important three characteristics, and if there is 2 out of them or more, we diagnose irritable bowel syndrome with recurrent abdominal pain. Now let's explain why and how this disease is developed. We have no exact answer. We don't know why it happens, but we have several hypotheses. And first hypothesis is about gut-brain miscommunication. Gut-brain miscommunication means that brain is oversensitive signals from our gut, and this nerve gut-brain communication is disrupted, and brain is oversensitive to the pain from even normal events in our gastrointestinal tract. So when food is moving in our intestines, our brain can perceive it as a pain. So it's gut-brain miscommunication. Second important hypothesis is microbiome imbalance. What means microbiome imbalance? It means that gut flora is changed, and there is bacteria which produces methane and gas. So gas producing bacteria are predominantly presented, and also we have food intolerance. So it means that we cannot absorb difficult or complex carbohydrates, and these bacteria metabolize them, or they eating this food instead of absorption, and they release gases. That's why person has this distension, bloating, and gas formation. And in many cases, people have early life stress events. They have stress events in past. So it's also important risk factor, and food sensitivity. It's not directly allergy, it's not food allergy, it's different from food allergy, but looks like, and person is unable to digest specific foods. So food hypothesis is also important. Their four most important hypotheses is gut-brain miscommunication, microbiome imbalance, food sensitivity, and early life stress. And what are the risk factors? Who are in risk? Usually women before the age of 50. Twice the difference between female and male ratio is 2 to 1. It means that it's much more common among women. anxiety is risk factor, depression is risk factor, and family history of IBS is also risk factor. Now let's say about treatment. Treatment is divided in 3 parts. We have treatment of IBS with diarrhea, treatment of IBS with constipation, and mixed form. Let's start with diarrhea. First, we should eliminate is high-fat foods, caffeine, and artificial sweeteners. They can trigger IBS and diarrhea. And low FODMAP diet is important also. What means low FODMAP diet? It means that some foods and many foods, and I will tell you which foods are like this, they contain complex carbohydrates, and this carbohydrates is not absorbed in some persons, some people's body, and there is difficult to absorb these complex carbohydrates, and person has symptoms. So we should eliminate these FODMAPs. And what are the FODMAP foods? Are wheat-based products like bread, pasta, crackers, cereals, cakes. So wheat-based products are FODMAPs. Also garlic, onions, legumes, beans, lentils, chickpeas, they are FODMAPs also. Also dairy products and some fruits like apple and pear also are FODMAPs. So lots of foods are FODMAP actually, so you should be carefully. And during IBS treatment, it's important to eat low FODMAP foods. Also, this FODMAP food intake and result and symptoms are dose dependent. It means that if you intake low amount, small amount of such foods, FODMAP foods, symptoms will be will not be triggered or will be very mild. It dose dependent in many cases. So low FODMAP food is priority. What are such foods? For example, psyllium is important. Psyllium is a natural soluble fiber, and probiotics also is important for IBS treatment. And low FODMAP foods are oat, rice, quinoa, eggs, tofu, banana, meat, chicken products, but this meat should not be processed. It's important. And dairy products without lactose also considered safe, and also strawberries, for example, and blueberries, they considered also safe, and they considered also low FODMAP foods. Also, spasmodics are part of treatment, such as hyoscine and dicyclomine. They are antispasmodics, and drotaverine also antispasmodics, and drotaverine has less side effects. That's why it is popular. So it's important. And also antibiotics such as rifaximin is important. Why it's important? Because it's not absorbed, and it has no systemic side effects and systemic action. It has more local action, and it affects these methane producing bacteria. That's why it's important. Cognitive behavioral therapy also is important, and stress management is important also. And loperamide or Imodium is important, which is used to stop diarrhea. It's very important medication also. Now let's say treatment of constipation, predominantly with constipation. At this case, high fiber diet is priority, and you should get high fiber gradually. It's very important also. Why gradually? Because high fiber diet, if you start with high amount of such foods, it can cause gas production. Oats, chia seeds, flax seeds, and cooked lentils and beans and berries are effective at this case and are recommended. Laxatives such as polyethylene glycol is recommended if there is important constipation, but you should use such laxatives for short term because they have side effects. They can cause dependence, so they are not recommended for long term. And in case of IBS mixed form, we should balance fiber intake, soluble fiber and insoluble fiber. We should balance them between them. We should balance these two types of foods from IBS-D and IBS-C. We already said about them, and you should balance them. And peppermint oil also is used to reduce pain and reduce cramps, and it dependent if there is constipation period, possible laxatives to use, and if there is diarrheal period, then Imodium can be used. And about foods, it's important what to eat. People often asking what to eat when I have irritable bowel syndrome. Ginger is good solution because it helps digestion and reduce diarrhea. Lean meat is important because especially chicken and turkey, because they absorb easily and they are good source of proteins and easily digest. Oat also is good source of soluble fiber. Carrots also low FODMAP food and easy to digest. Bananas, especially green bananas, are good because they are low FODMAP also. And rice, potato, and green beans also is low FODMAP food. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like